Welcome to the Smooth Forest Fitness Podcast. I'm Lamar, your host, and I have the honor to introduce Dr. Luke Marji to the podcast. Dr. Marji is a MD with formal training in general surgery, anesthesiology, internal medicine, board certified internal medicine, and associate professor of medicine at Lake Erie of Medicine. How you doing, Doc?
I'm good. I'm good, brother. Good to be here.
I'm glad. I appreciate you being on a podcast, and it makes it a little bit more special knowing that someone I knew for about 20 plus years is on this podcast. And I knew you before you became a doctor. I know you're 11 years in as a doctor. And I recall when you was younger, you mentioned that you wanted to be a doctor. And I don't know if everyone believed you, but I believed you because you're so determined. And look at that, 11 years in as a doctor. So congrats on your tremendous accomplishment. And I'm sure the listeners are looking forward to hear some questions we have for you.
Thank you. Thank you for having me. And, as I'm also happy to know that you're doing everything you've always wanted to do.
I appreciate it.
Uh,
So let me start off with, how often should people go for a doctor's checkup?
so, preventative care is always the best care. Um,
Mm-hmm.
the impact that uh, it has on healthcare. People are using the emergency room a lot of times as their preventative care, showing up for routine things that they should be seeing their doctors. Or a lot of times now we have urgent cares all over the place, and people are showing up there. But preventative care is always the best care. If everyone was to take care of themselves and prevent things from happening, that's really the best medicine. But in case you need to be treated or anything like that, following up with your doctor, making sure you get all the routine things done is super important. So there are things that need to get done as we get older. Do a really good job at seeing the doctor up until we're 14 years old, and then we don't see them anymore. And a large part of that is because our parents kind of have to. Um, at least once a year, if you're generally healthy.
Okay.
If anything is off in your
Mm-hmm.
routine labs, if anything is off in your vital signs, such as having high blood pressure, a lot of times the doctor will want to see you anywhere between 1 to 3 months. We'll give you some time to maybe, get your act together and start focusing in on your health. Um, and we'll redo whatever testing needs to be done. And if there's still abnormalities, or if it's worse, they might want to see you in another 1 to 3 or 3 to 6 months. If you're generally healthy, you should be seeing them at least once a year, making sure you stay that way.
Once a year, nice. There's been times in my life I went several years without seeing a doctor, and I told myself that's just not healthy. No matter how healthy I feel I am, no matter how clean I eat or train, it's just not a good idea. Preventative care is key. So I agree with you. Once a year, at least, is ideal. This question is for the men, and for the men who are getting older, late 30s, 40s, 50s, comes to the prostate. Okay, and that's for some men, it's a sensitive topic, but men don't like the idea of having a prostate exam. Despite the discomfort or fear of the exam, it can be life-saving. At what age or what symptoms should a guy speak to his doctor about the exam?
Uh, a good internist or a good family physician, a good primary care doctor out in the community is going uh, is going to try and convince you to get your exam done when the time comes. You're not going to get a prostate exam routinely. It's something you get if you're symptomatic or once you start to get a little older. Um, I would say once you start to get into your mid to late 40s, or once you're about uh, 50 or so, you're probably going to get one. And a lot of times the gastroenterologist is going to do one when he or she does your colonoscopy. So the colonoscopy
Okay.
recommendations now are not 50 years old anymore. They're recommending people doing it at 45 now routinely. That is the new standard,
Mm-hmm.
gold standard recommendation. And symptoms you want to be on the lookout for are any change in your ability to urinate, any change in the frequency of your urination, any change in the
Mm-hmm.
hesitancy, the if you have an urgency, you want to go see your doctor right away. A lot of times, a prostate enlargement is not cancer. It could be what's called BPH, benign prostatic hyperplasia, and there are treatments for that. So, and if God forbid it is cancer, there's also treatments for that. And like I said, preventative management is the best. Sometimes you can't prevent things, but catching them early is can be the difference between going through chemo, radiation, and surgery, and
Mm-hmm.
having different procedures where you risk now uh, uh, nerve damage, you risk having erectile dysfunction, which is devastating to a man, obviously,
Mm-hmm.
for more than just reproductive causes. Um, the mental
Mm-hmm.
health aspect of it, everything, so these things can be devastating to a man's physical and mental health. Um, so so it's super important that you just go with the recommendations, let your doctor do what he or she has to do. um, but if you're definitely having those symptoms I mentioned, any pain when you sit down, um, any symptoms that I mentioned, it's super
Mm-hmm.
important, go see your doctor right away.
Definitely, definitely. And as you know, us men, it's just it's not an exam we want to take. We hear stories about it, but it's life saving. It's life saving. Put the ego to the side. Once you reach a certain age, just like Dr. Marji said, get that exam done. It's life saving. Preventive measures is key. So I like that. Hopefully everyone listens and we stay safe and live longer. Now, leading into what is more detrimental to one's health, a high sugary diet or a sedentary lifestyle?
Oof. I mean, they're definitely they're definitely both horrible for you.
Mm-hmm.
And there's a saying out there, which someone who tries to run, or myself, once in a while stay fit. It's hard when it's busy, when you're busy, but you should always give yourself some time, because if you want to be there for everything that's going on in your life, your family, your
Mm-hmm.
career, you and you want to be there longer and enjoy it longer, quality of life is just as important as quantity of life. And there's a lot of
Yes.
times there's no point in having a long quantity of life without having a good quality of life.
Well
Because
said.
yeah, it really, I mean, it these are the talks we have with patients. These are the talks we should be having with patients.
Quant is not all about quantity of life, but it's quality of life. You want a healthy balance of both. Is that what you're saying?
A- Absolutely, yes. There's no point in extending your life if you're going to live it in misery, and in depression, because you can't do the things that you want. Um, so and you can't, partake in the joys that life has to offer. So it's very important that we focus on our health and our preventative management. There's a saying out there which I also believe: you can't exercise your way through a crappy diet. So it's got to be balanced. You got to have a balance of healthy eating, and you got to have a balance of working out, because also when you work out, you're not going to achieve the results you want to achieve if you're not feeding your body the right type of nutrients. Because at the end of the
Mm-hmm.
day, the nutrients that we take in is all broken down into energy. And if you want to have energy for life, if you want to have energy to work out, if you want to have energy for your body to rebuild, if you want to have energy for your mind to rebuild, if you want to be physically and mentally healthy, you got to exercise, and you can't live a sedentary lifestyle, because people forget of the mental health effects that comes with living a sedentary lifestyle. So it's super important that we do that we balance our health by working out and feeding our body. You know, when we buy a luxury car, we go out there and we buy a Ferrari or a Benz or a BMW or an Acura or whatever it is that you drive, your baby. We
Mm-hmm.
don't. A lot of times we see people out there putting 93 in their car, spending that extra money to put that into their car because they don't want to feed their baby crap, you
True.
know. So what about your body? You know, it's there's nothing more important than your health, and believe me, there is nothing more important than your health, because if your health fails, nothing else in the world matters once your health starts to fail. And these are the things, as a hospitalist working in a hospital day in and day out, these are the things that I see every day. As doctors, we're also social workers too.
Mm.
You know, not to take away from what the social workers do, but we deal with the same things they deal with. And when a patient comes into the hospital, we deal with the social aspect of it too. What's going on at home? You know, we that is all part of our conversation, and we in our rounds when we talk about our
Mm.
patients, it's not just the medical management; it's the social management as well. We take that into consideration with what medications we might prescribe, whether or not they go to a nursing home or not. I mean, these things are
Mm-hmm.
super important, and so if your health starts to fail, nothing else in the world matters. I want people to realize that, because these are really the things that I see every day, and it devastates people's life. And and all of a sudden, what job you had, what relationship you were losing, what, you know, whatever was going on in your life, it doesn't matter anymore. So it's so important that we take care of ourselves, so that we don't have to deal with the most devastating thing in the world besides death, which is our own health starting to fail. And so preventative management includes you doing your part, not just going to the doctor. You know, you when you go see the doctor once a year, you want to make sure that you have a clean bill of health, and it's on you. Your doctor's seeing you once a year for 15 to 20 minutes if you're lucky these days,
Mm-hmm.
you know?
Mm-hmm.
So you got to do your part. You know, you're stuck with you, and you got to determine the way you want to live your life,
I like that. I like that. I like that a lot. I really do. Uh, I never
you know?
wanted to be a person who had a poor quality of life due to mobility issues or just internal issues or anything. I kind of want to relate it to being able to swim. If you know how to swim, when you go on vacation, let's say you go to an island for on vacation, wherever you go, anywhere with water, and you can't swim, you can still enjoy yourself, but it's just not the same. It's kind of like for health. If you're overweight, let's say you're overweight, you can't do a lot of stuff if you're overweight. Let's say it where it is. You can't do a lot of stuff. Your mobility is going to be off. Hypertension. There's a lot of stuff that's going on that you can't do the same. So you can't get the most out of life. Maybe this is a better way to compare. You can't enjoy life as much if you're out of shape. Just like if you're on vacation, you can't swim. You can't get the most out of it. You're limiting what you can get out of life. So let's stay fit, eat properly, and just get the most out of your time on earth. So you said it phenomenally. You said it phenomenally. And I actually mentioned hypertension, and that kind of leads into my next question, which is, can you explain the systolic and diastolic readings for blood pressure, and how should a patient with stage 2 hypertension ease symptoms without medicine?
Yeah. So a lot of times, even in stage one and stage two, maybe even stage three hypertension, there aren't really many symptoms that are going to be experienced.
Mm-hmm.
So there's not a lot of symptoms to ease necessarily, but there are side effects of having hypertension, long-standing hypertension.
Mm-hmm.
Hypertension is not something that should be taken lightly. Hypertension is what
Mm-hmm.
leads, a lot of times, in addition to other diseases as well, such as diabetes. Um, uh, Hypertension is what leads to strokes, heart attacks. It could lead to you having irregular heart rhythms, which have their
Mm-hmm.
own sets of side of complications. So
Mm-hmm.
hypertension is a major, major issue. Uh, it's because it has to do with bad eating habits. Some of it has to
Mm-hmm.
do with with you know genetics.
Mm-hmm.
Race is important. A
Mm-hmm.
lot of
I
times
heard,
you
yes.
might tailor your medications for an African American male who might
Mm-hmm.
have a strong family history, um, of parents and siblings going on dialysis as a result
Mm-hmm.
of diabetes and hypertension. So you might
Mm-hmm.
want to tailor your treatment of hypertension, um, as opposed to treating a white female with hypertension.
Mm-hmm.
So hypertension is very well studied. We have a lot of different medications to treat it. Um, and uh, there are some medications that have side effects to them, but we can change those medications around, because at the end of the day, hypertension has so many complications that we can sit here and talk about that just in a whole podcast.
Mm-hmm.
And it is so important that our patients uh, um, uh, take their medications as scheduled every day at the
Mm-hmm.
same time. Um, uh,
Mm-hmm.
so, so taking your medications and bringing down your blood pressure back to a normal range is very important. Now, you'd asked what was the difference between your systolic and diastolic blood pressures. Your
Mm-hmm.
systolic blood pressure, the top number, is the number of the pressure that you're generating with each time there's a beat of your
Okay.
heart, and basically that pressure is generated. um, it has to be higher than the pressure. It has to overcome the pressure in the aorta, which is the major vessel coming off of the heart, so that way that blood can just move forward. The heart pumps it, but it has to, in order for it to move, your blood to circulate, it has to overcome the pressure that's in the main vessel and in the pressure
Mm.
of the rest of your vessels. So,
Okay.
and the higher your pressure, the harder your heart has to work. Your heart beats
Mm.
on average should be beating between 60 and 80 beats a day. Sometimes it's higher, sometimes it's lower, depending on what we're doing. And just do the math. 60 times a minute, times
Mm-hmm.
60 minutes, times 24 hours, and multiply that by somebody's life. And that's your heart is working nonstop. It's
Mm.
actually pretty amazing if you think about it. Your heart is beating right now, working the same way electricity works, and you're not plugged in. Um,
Mm-hmm.
so if you start to think about the human life and just life in general, the life from there, it's incredible. It's amazing. It's a miracle. It really is. and
The body's amazing. Yes.
it's amazing. It's amazing. You are one of the best designed machines that God ever
Mm-hmm.
created.
Mm-hmm. Very
And
true.
it's incredible, actually. I sit there sometimes and I just think about it, and I'm like, wow, like, like I'm running right now, and it's incredible. So, so that's the pressure that's the pressure that is happening with your heart in action, with the beat going on. Now,
Okay.
when your heart is beating, there's a what we say a lub dub, lub and then dub. In dub, your heart is resting. There's no beat. It's filling
Okay.
up with blood, getting ready for that. It's that chamber is getting ready to squeeze out that blood. Um,
Mm-hmm.
so that's your pressure at rest. It's important also to have a good ratio of the difference between the two. So you
Okay.
don't want to have a low bottom number and a very high top number either. But you
Okay.
don't want to have both of them very low either. So,
Mm-hmm.
there when we go into shock, when they say that patient went into shock, what it means is that patient's blood pressure is very low. So
Mm.
that's what shock really is. So you don't want to ever be too low either.
Mm.
So it's very important that that both your top and bottom numbers, the systolic and the diastolic, are within the range that they're supposed to be in.
Nice, 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 nice. Well explained. Uh, there's two more questions I want to ask you. I'm not really sure which order I want to ask them. But let me keep it the same, just because what you said, is some such good information. So let me lead into the kidneys and the liver are the body's filters. What can we do to decrease stress on them?
So yeah, so the first four letters in the word liver is live. If if
Mm,
if if you want to keep it
mm.
funky, uh, so
Yes,
uh,
that's true.
so so
Yeah.
um, so it's very important. So one of the best things you can do for both your liver and kidney is stay hydrated. Drink
Okay.
lots of
Okay.
water. Drink the recommended amount of water. Drink your 8 glasses, your gallon, whatever it is, your 64 ounces a day that you need to get in.
Mm-hmm.
Um, uh,
Okay.
we are made up of all water. Everything in our body is water.
Mm.
It's very important that we stay hydrated. If you stay hydrated, for the ladies out there, they love having those big plump lips, those big juicy lips. You want to have good looking
Mm-hmm.
lips, stay
Mm-hmm.
hydrated. You want to have good looking skin,
Yes.
stay hydrated. Moisturize.
Yes.
Everything, when you moisturize, what is moisturizing? Hydrating. It's
Mm-hmm.
moisture. It's hydrating. You want to hydrate your skin, your body. You want to hydrate your insides. Are just as important. Keep them lubed up. Keep them running well. You want to
Yes.
stay in a well-oiled machine. So
Nice. Nice.
yeah. So
So
it's very
drinking water.
important. There's also another saying out there, when for my surgeons out there, they know, the dilution is the solution to pollution. So if there's
Mm.
infection, stuff like that, we dilute it out with more water. We just keep irrigating out, in the belly, stuff like
Okay.
that. So
Nice.
same thing with our kidneys and liver, when they're filtrating things out. Um, Let it be filtered out, diluted rather than concentrated with high
Okay.
toxins. So it just
Okay.
it decreases the workload on our body.
I like that. You were so I had my water container. I was gonna take a sip of water, but here we go. I got my jug. So just because let me get my sip of water. Hydration is key. Everyone drink your water. It's important.
Yeah, I
That
mean,
was that was
I know you like to work out. When you work out, if you go work out, how many times have you worked out after a night of partying,
Oh,
where
the energy is
you've
terribly
been
low.
drinking, you
Energy is
start to
terribly
cramp
low.
up. Oh,
Yes, I
it's hard.
cramp up,
It's
strength is
not.
down.
It's not easy. It's not easy.
It's not. It's not.
Yeah,
It's
yeah.
not. Yeah, yeah. 100% right. 100% right. Now, this on this question, now I was debating on if I want to ask this question first or the question I just asked first. Uh, because you mentioned you was talking about high blood pressure. We spoke about it. So the final question, and I really appreciate all the answers you've been given. I hope everyone really listens to this because this is life saving information that Dr. Marji is giving you right now. Just something to really think about. If someone, and this one is, and you mentioned different nationalities and so on. This one is really, I want everyone to really pay attention to this answer right here. If someone with family history of hypertension or cancer, is that person doomed? Who Are there preventive measures, or are they just doomed? Like, yeah, my grandparents or my parents had whatever disease. Am I just doomed? Is it going to happen to me? Or can I kind of like prevent some of those situations?
Yeah, so you're not doomed. Just because somebody in your family had something happen to them does not mean it's necessarily going to happen to you. Family history is super important when we're taking a patient's history, because a
Mm-hmm.
lot of times it will guide our management. For example,
Mm-hmm.
if you had a family member who had colon cancer, a first degree relative, mother, father, brother, sister, the
Okay.
recommendation for getting a colonoscopy is 45 years old or 10 years before your first degree family member had when their cancer was discovered. So if you
Oh
had a
wow. Okay.
brother, mother, father, sister, um, who had colon cancer, let's say at 30 years old, you're getting your colonoscopy at 20,
Oh
not
wow.
at
Wow.
45. And the
Mm-hmm.
monitoring might be more frequently rather than 5 to 10 years. It might be in 1 to 2 or 3 to 5 years, where you will need a repeat colonoscopy. Um,
Oh wow.
that's just one example. If you have a strong family history of diabetes, type 2 diabetes, or type 1 diabetes, um,
Mm-hmm.
uh, in type 1, a lot of times it's discovered early in childhood or early adulthood, adolescence. But um, type 2 diabetes uh, is something that we can prevent, um,
Mm-hmm.
by watching our hemoglobin A1C and making sure we don't eat foods that have a high glycemic index all the
Okay.
time. There are people who live on the sugary diet,
Mm-hmm.
and they are very prone to diabetes. Um,
Mm-hmm.
uh, if you have a strong family history of heart disease, there are things that us as physicians we're going to do more frequently, or may change the plan for your preventative care. Um,
Okay.
so, uh,
Okay.
so preventative care is key, and there are some instances where the genetic predisposition is very strong and is likely going to happen, um, and we do everything we can. We can't do anything to prevent it sometimes, but there are some things we can do to make sure that you live the best and longest quality and quantity of life that you can have, by tailoring your treatment to your specific need.
Yes.
And so we always take the patient's family history, in when we might start them on a medications to start lowering their cholesterol, let's say. We have these patients where they've had their three brothers and their mother, and their mother and father, both, all five of them have they tell me in the office sometimes, you know yeah, five of my family members just dropped dead one day, and
Oh
and
wow.
from
Wow.
from heart complications, and so with that patient, I might want their cholesterol level and their hemoglobin. I might be more aggressive about when I start treatment. I might be more aggressive about where I want those numbers, and I
Oh
might be
wow,
more
wow.
aggressive about how much I want to push that patient to really do what they got to do. You know, and what type of talk I have with them in the office or in the hospital. So it's very important.
Nice, nice. Dr. Margie, I truly appreciate you taking time out of your busy schedule to talk to me on this podcast. I really hope the listeners really listen to what Dr. Margie said. This is life saving. If if you are on medicine, do what you have to do, but let's prevent us having to get to the point where we need medicine. Let's cut out the sugar. Let's cut out the sedentary lifestyle. Let's do what we're supposed to do to live a long, happy, healthy life. And if you do, by any chance, don't want to listen to this, Dr. Margie, you may want to reach out to him. So, with that said, how could someone contact you?
Yeah, I can be reached by email. My email is lmarji LMARJI 52 at gmail.com. I can be reached on social media. You can go on my Facebook, which is my first and last name, Luke Marji, LUKEMARJI. I respond Facebook Messenger. Um, Not really too into social media, but you can reach me through TikTok at MDMC 221. Uh,
Okay.
so you know, I told you earlier before we got on camera that I was I make beats and stuff like that. So my TikTok, little play
I
on words
found
there, MDMC, you
it.
know,
Nice, nice.
just to keep it a little funky there. So
So you're a doctor and you have personality. That's what you're saying.
yeah, nah, I'm saying I'm a doctor and I got some swag. Let's keep it funky.
Okay.
So I was just playing. Not really, but you know,
Not like
uh,
that.
yeah. So yeah, so, hit up my TikTok.
Do it, do it. Everyone, you heard from Dr. Margie. You heard it right there. Once again, I really appreciate you being on this podcast. We will definitely speak again. And if it's okay, if we have medical questions in the future, I would love for you to be that doctor who could explain, give a doctor's side of these questions. So perhaps we can
Absolutely.
do that down the road. Definitely. You definitely be back then. Thank you. Enjoy your day, and we'll speak again.